Hi, my name is Dr. Antoinette Merich, and I'd like to take you through the process of the Healthcare Workers Care Network, just the logistical process of how the healthcare worker makes contact with our network, and then how the healthcare workers responded to. So I'm just going to take you through a PDF which is available. So the healthcare worker makes contact, and the method of contact is through, and when I'm talking about healthcare workers, I am talking about all different levels of healthcare workers. So anyone who really works in a medical setting in the public or private sector. So the healthcare worker will complete a form on the SAMA website, which I will show you where the link is. Or they can complete a form on the VULA or the EM Guidance app. They would have to download these apps, register for the apps, and then they can follow the mental health prompts. We are working very closely with VULA and EM Guidance to provide this. On VULA, normally VULA is a referral network from doctor to doctor for patients. However, where it's going to work in this situation is VULA is going to be a platform so the healthcare worker can refer themselves, and that referral go through to a national coordinator. At this stage, it's Caroline, who then can automatically on the app refer on those healthcare workers to regional contacts and to other contacts. A similar process on the EM Guidance app. The EM Guidance app is actually a form, and it's very similar to the form on the SAMA website, and the healthcare worker will complete the form, and then the form is going to be emailed to the national coordinators. Alternatively, if there's an emergency, and you'll see on our forms that there are emergency numbers listed, the contact will either come from a SADC or an Akiso call center agent. We have listed the Akiso call center emergency response number as one of our emergency contacts, and as well as the SADC. It's actually the junior doctor's line, which we're using at this stage. So the healthcare worker makes a request, and as I've said, that request will then move to the national coordination, where it will be received by either Caroline Lee, who is from SASA, Anaesthetists Association, or Rosanna Naidu from SAMA. This request will be allocated to a regional level. If the request is seen to be urgent, and there is a place on the form where the healthcare worker can mark this as urgent, it will be allocated as soon as possible. And this may require one of the national coordinators phoning directly one of the therapists or phoning the regional coordinator. The remainder of the request will be emailed to the regional SASOP contact. Thereafter, once the regional SASOP contact receives the request, we are asking the regional SASOP contact to please try and allocate that healthcare worker within 12 hours, if possible. And each regional SASOP will receive a database of all the volunteers in their area, and they can allocate the healthcare worker to a volunteer therapist. This will require that the regional coordinator sends the therapist who's been allocated the healthcare worker's details, and will also send the healthcare worker's detail up. We'll also send to the healthcare worker the therapist details. And please ask both the therapist and the healthcare worker to make contact within 24 hours. Regional SASOP will then need to have a system where they can follow up that contact has been made between the healthcare worker and the therapist. And if there is no response from the healthcare worker after you've tried to look on the contact, please let national coordinators know so they can follow up. Ask that the therapist lets you know when the first session is made, and I can send you through a template of that email. And then also ask that the therapist lets you know when the sessions are completed. We have made up a feedback form. This was actually Bernard's idea. He really wanted to try and get some data and collect some data on just the themes and nature of the sessions, not the healthcare worker's name. So it's an anonymous feedback form. I've also set that up, and that can be available. Once you're aware that the therapist has terminated with the healthcare worker, please inform the national coordinators so that we are able to just keep track of all the healthcare workers and where they are in the process. I would suggest that you do this in a batch on a weekly basis. So one day a week, you just sit and email all the therapists that you've referred to check if anyone's completed, send them feedback forms, and then follow up with National, and you can send them that detail on a weekly basis. And then just once again, the Healthcare Workers Care Network is a collaboration between these following parties. And we're very excited to work with all of these. So it's SADC, SAMA, the Mental Health Care for COVID Healthcare Workers in Gauteng, which is the group I started, SISA, SASA, and SASA. I'm going to do another video just looking at the regional response and just explain that a bit more in detail.